Your prostate hates these things you put in your body, and today we're going to talk about exactly why. Before diving into the specific things that negatively impact the prostate, it's important to understand the connection between diet and prostate health. First of all, the prostate is a small gland that plays a vital role in male reproductive health. Situated just below the bladder and surrounding the urethra, the prostate gland produces seminal fluid, which nourishes and transports sperm. However, the prostate is prone to a number of health conditions, most notably benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer. These conditions can significantly affect the quality of life in men, especially as they age. While many factors contribute to prostate health, such as genetics, lifestyle, and physical activity, diet or what you put into your body plays a pivotal role. There are specific foods that can either help maintain a healthy prostate or contribute to the worsening of prostate-related conditions. The prostate gland is highly susceptible to inflammation and hormonal imbalances, both of which can be influenced by the foods we consume. Let's now explore the worst foods for prostate health, breaking down why each should be limited or avoided altogether. 1. Red and processed meats. Red meats like beef, pork, and lamb, as well as processed meats such as sausages, bacon, and hot dogs, have been linked to an increased risk of prostate cancer. Studies suggest that high consumption of red and processed meats is associated with a higher risk of aggressive prostate cancer. This connection is largely due to the cooking methods used, such as grilling or frying, which can lead to the formation of carcinogenic compounds that may increase your risk of cancer. Moreover, processed meats are high in sodium and preservatives, which can contribute to inflammation and hormonal imbalances. Always opt for lean protein sources like chicken, turkey, and fish, especially fatty fish like salmon and mackerel, which are rich in omega-3 fatty acids that have anti-inflammatory properties. Plant-based proteins such as lentils, beans, and tofu are also excellent choices. 2. Dairy products. A diet high in dairy products, including milk, cheese, and butter, has been linked to an increased risk of prostate cancer. The consumption of large amounts of calcium from dairy is thought to lower levels of a form of vitamin D that protects against prostate cancer. In addition, dairy products can contribute to hormonal imbalances, particularly because they contain estrogen and other growth hormones that may promote prostate growth and inflammation. The saturated fat content in full-fat dairy products can also contribute to overall inflammation. Always opt for plant-based milk alternatives like almond, soy, or oat milk. Choose low-fat or non-dairy sources of calcium, such as fortified plant milks, leafy greens, like kale and spinach, and almonds. Greek yogurt made from plant sources is another option for a protein-rich snack without the dairy. 3. Saturated and trans fats. Saturated fats, found in foods like fatty cuts of meat, butter, and full-fat dairy products, and trans fats, found in many processed foods like margarine, baked goods, and fried foods, can increase inflammation in the body. Chronic inflammation is a key driver in the development and progression of prostate diseases, including cancer. Diets high in saturated and trans fats can also lead to obesity, which is a risk factor for more severe prostate issues such as BPH and prostate cancer. Moreover, excess fat in the diet may increase the levels of certain hormones, such as insulin and testosterone, which can stimulate the growth of the prostate gland. Replace unhealthy fats with healthy fats, such as those found in avocados, olive oil, nuts, and seeds. Fatty fish rich in omega-3s, like salmon and sardines, are also beneficial. These fats have anti-inflammatory properties and can promote better heart and prostate health. 4. Alcohol. Excessive alcohol consumption can negatively affect prostate health. Alcohol acts as a diuretic, which can lead to frequent urination and exacerbate symptoms of BPH, such as the need to urinate frequently, especially at night. Additionally, alcohol can interfere with the balance of hormones, particularly testosterone and estrogen, which are important in regulating prostate function. Heavy drinking is also linked to inflammation, which can contribute to both BPH and prostatitis. Limit alcohol consumption to moderate levels, if at all. Hydration is crucial for prostate health, so focus on drinking plenty of water, herbal teas, or beverages like green tea, which contains compounds that may have protective effects against prostate cancer. 5. Refined carbohydrates and sugars. Refined carbohydrates, such as those found in white bread, pastries, and sugary cereals, along with added sugars in soft drinks, sweets, and desserts, can lead to increased insulin levels. Elevated insulin levels have been associated with a higher risk of developing prostate cancer. Additionally, diets high in refined sugars promote weight gain and inflammation, both of which can worsen prostate health. Obesity, in particular, is a known risk factor for BPH and prostate cancer. Switch to whole grains like brown rice, quinoa, and oats. These foods have a lower glycemic index and provide sustained energy without causing insulin spikes. Choose natural sweeteners, such as honey or maple syrup, in moderation, and prioritize fruits like berries, which are rich in antioxidants and have a lower sugar content. 6. Excess salt. A high-salt diet can exacerbate symptoms of BPH by causing fluid retention and increasing blood pressure, which in turn puts pressure on the urinary system. This can lead to more frequent urination, particularly at night, and can make it more difficult for men with BPH to empty their bladders. Furthermore, high sodium intake is linked to overall inflammation in the body, which can have negative effects on prostate health. Reduce your sodium intake by choosing fresh, whole foods over processed and packaged products, which are often loaded with salt. Flavor your meals with herbs and spices instead of salt. If you do need to add salt, use it sparingly and opt for sea salt or Himalayan salt, which contain trace minerals that can be beneficial in small amounts. 7. Caffeine. Caffeine, found in coffee, tea, soda, and certain energy drinks, is a stimulant that can irritate the bladder and worsen symptoms of BPH, such as frequent and urgent urination. Caffeine also has a diuretic effect, increasing urine production and exacerbating urinary symptoms in men with prostate issues. Additionally, consuming large amounts of caffeine can increase anxiety and stress, which may indirectly affect prostate health by raising levels of cortisol, a hormone that can contribute to inflammation. Limit your caffeine intake by switching to decaffeinated coffee or tea. Herbal teas, especially those containing anti-inflammatory herbs like chamomile or ginger, can be soothing alternatives. Drinking plenty of water is essential to maintaining proper urinary function. Remember, taking control of your health is in your hands. Don't forget to give this video a thumbs up if you found it helpful, share it with your friends, and of course, subscribe to Vitality Unplugged for more health tips and wellness advice. Until next time, stay healthy, stay vibrant, and take care of that prostate.